Okay, thanks a lot, Ron. It's February, so it's Heart Disease Awareness Month, and we have Dr. Dr Osborn here from the Intermountain Medical Center Heart Institute, and today we are talking about heart health. In fact, you have a whole, like an expo coming up this weekend.
Coming up on Saturday from 9 to 1
right.
At Intermountain Medical Center.
Well, and I think a lot of people are surprised to find out that heart disease actually kills more people than all cancers combined.
Absolutely, and you know, they say as many as 2,200 people die a day of cardiac disease or stroke.
And you don't know what's there, so you have to get it checked.
Absolutely.
And what kind of tests do you need to have done?
Well, fortunately, and these are free tests, free screening tests that are available on Saturday morning, or Saturday from 9 to 1 at Intermountain. We do EKG, we'll do blood tests looking at cholesterol and looking at glucose.
Well, and those are things that make you more at risk. It's not necessarily saying you're going to have a heart attack, but it puts you more at risk.
I think it could be reassuring to many people that have concerns and maybe haven't been to the doctor lately, and maybe they need to get in and get checked.
Okay, and to have a free expo like that is really important.
And it will be informative, too. There'll be cooking classes and a cookbook that's available. And,
free cookbooks.
Free,
yeah. With healthier recipes.
Absolutely. And I think it's all designed about trying to inform people, and I think having an informed patient is a good thing in my book.
That's right, and I think heart disease and any kind of heart awareness, everybody has one. It's not just a men's disease or just a women's disease. It cuts across the board.
Yeah, and unfortunately it's so prevalent, and I think everybody needs to do some of these screening tests, even at a young age.
Right. So get started so you have a baseline and you know what your history is, and check out your family history as well.
Better to know.
Right. And tests like this also, I think men have different symptoms than women, so there's also some education available what symptoms are different for women than men.
That's true, and you know, it used to be that women had a hard to diagnose disease. I think anymore we look at symptoms seriously in women and men, knowing that the women maybe are protected for a few more years based upon female hormones, but once they get to a certain age, their risk is just as high as men.
One-stop shopping this Saturday. Okay. Check it out. Thanks so much.
Thank you. Come on down.
All right. We'll be back in just a minute.